Welcome to the deep dive. Today we're tackling hydronephrosis in dogs and cats. Basically, it's a condition where urine backs up in the kidney.
Right. Causes swelling.
Right.
And potentially, some pretty serious harm.
It sounds technical, but
Uh-huh.
it's actually really important for pet owners to kind of get what's happening.
Absolutely. And to help us sort through it, we're focusing on this really clear expert overview called canine and feline hydronephrosis.
Okay.
Our goal here is just to pull out the most vital info for you. We don't want to get bogged down in super complex stuff.
Think of it as the essentials.
Exactly.
Yeah.
Your shortcut to understanding what matters.
And here's something interesting. A lot of people might not realize this, but often, especially if it's just one kidney affected, well, your pet might not show many signs at first.
Or any signs at all, yeah.
So just being aware that's possible
Yeah.
is really key. Okay, so let's start with the basics. What is hydronephrosis fundamentally?
Well, the core problem is a blockage. It's in the ureter, that tube carrying urine from the kidney down to the bladder. And when that flow gets blocked, the renal pelvis, that's kind of the collecting area inside the kidney, it starts to get distended, swollen.
Like kinking a garden hose, essentially, for the kidney.
That's a good way to picture it, yeah. And this urine backup creates more pressure inside the kidney, hydrostatic pressure.
Right.
Think of water building up behind a dam. That pressure then starts to squeeze and compress the actual kidney tissue, the parenchyma.
A working part of the kidney.
Exactly, the part that does the filtering. And it can cause it to atrophy, to sort of waste away over time.
Wow, okay. That sounds pretty serious.
Yeah.
How common is this, and does it usually hit one kidney or both?
Well, what's interesting is that most of the time, maybe 80 to 85% of cases, it's unilateral.
Just one kidney.
Just one, yeah. Bilateral, where both are affected, is less common. That usually happens if there's a problem affecting both ureters or maybe something blocking the urethra further down.
So the other kidney can often compensate for a while.
It often can, yes.
Right.
Which really highlights why, routine checkups and blood work are so important. Even if your pet seems perfectly fine, you might catch early signs of kidney stress that way.
Okay, so a blockage in the ureter is the main issue. Let's dig into the why now. What kinds of things actually cause these blockages?
There are quite a few possibilities, actually. We can sort of group them. First, you've got problems directly with the ureters themselves.
Okay.
Uroliths, basically stones in the ureter. They're a pretty common cause.
Like little pebbles getting stuck.
Exactly. Then there are ureteral strictures, which is just a narrowing of the tube, makes it harder for urine to flow through.
Right.
Sometimes these strictures are linked to something congenital, like a circumcaval ureter, where the ureter takes a weird path around a big blood vessel.
Oh, interesting.
Yeah, it can sometimes get compressed that way. Then you've got neoplasia tumors growing in the ureter, or ureteral fibrosis, which is scarring.
And you mentioned accidental ligation, like tied off during surgery. That sounds bad.
It is, unfortunately. It can happen unintentionally during, say, a spay or a neuter, especially if it's cryptorchid, meaning a testicle hasn't descended properly, or even sometimes during surgery to fix ectopic ureters.
And what are ectopic ureters again?
That's where the ureter connects to the bladder in the wrong place. And that condition itself can lead to hydronephrosis, especially in male dogs, if there's also a narrowing right where the ureter meets the bladder.
Like a kink at the connection point.
Exactly. It's called UVJ stenosis. So, yeah, quite a list just for the ureters.
Definitely. What about problems further down, like in the bladder or beyond?
Right. Blockages lower down can also cause urine to back up. So things like bladder masses, transitional cell carcinoma as an example,
Okay.
or prostatic disease like prostate cancer. In females, even a mass in the vagina could potentially cause an obstruction.
Okay.
And though it's rare, like we touched on, that cryptorchidism issue leading to accidental removal of the prostate during surgery has been reported.
So blockages can happen at multiple spots.
Yeah.
Are there things outside the urinary system that can cause this too?
Yes, absolutely. There's something called retroperitoneal disease. That's the space sort of behind the main abdominal cavity.
Okay.
Masses there can press on the ureters from the outside. These could be granulomas, tumors, cysts, abscesses, even hematomas, blood clots.
Wow.
And other things too, like perineal hernias or even scarring from radiation therapy, that post-radiotherapy fibrosis.
Gosh, so the causes are really varied. Let's circle back to something you said earlier about pets not always showing obvious signs. What are some of those maybe more subtle things or historical clues that might make someone suspect Hydronephrosis.
Yeah, that delay in obvious signs is really key to remember. But as it progresses, or maybe if both kidneys are involved, you might start seeing things like inappetence, not eating as much,
Okay.
weight loss, maybe drinking more, peeing more, polydipsia and polyuria, sometimes blood in the urine, hematuria. And if it's really impacting kidney function, bilateral or with existing kidney issues, you might see signs of uremia.
That's the waste product buildup.
Right. So that could look like depression, maybe diarrhea, vomiting. And sometimes the pet just seems painful, maybe abdominal pain, especially if stones are the cause.
It's interesting, though, that urine production often continues, even with one ureter blocked.
Yeah, that's mostly because, like we said, it's often unilateral.
The other kidney picks up the slack.
Exactly. The healthy kidney keeps working. And even with a partial blockage, some urine can usually still sneak through.
Makes sense. So what might a vet actually find during a physical exam that points towards this?
Well, initially the exam could be totally normal. That's the tricky part for early detection.
Right.
But as things progress, the vet might feel an enlarged kidney that's renomegaly. Sometimes we talk about big kidney, little kidney syndrome. It suggests one kidney is enlarged from a current blockage, while the other might be small, maybe due to an older resolved blockage that wasn't noticed.
Well.
The pet might also show pain when the vet gently feels around the kidneys, abdomen, or the lower back area. Sometimes you can feel an actual abdominal mass, like a big bladder or prostate. And during a rectal exam, the vet might feel masses or even stones near the bladder, neck, prostate, vagina, or urethra.
So history and a good physical exam can definitely raise suspicions. How do vets actually confirm it, though? How's the diagnosis made?
Well, first you have to think about other things that could look similar, the differential diagnoses.
Like what?
Oh, things like just simple dilation of the renal pelvis without a real blockage, other causes of big kidneys, different reasons for belly pain, or other causes of azotemia like chronic kidney disease.
Gotcha. So ruling other things out, then what are the main diagnostic tools?
Blood work and urinalysis are usually the starting point, and like we said, they might be normal early on. But often, one of the first things we see is the kidneys losing their ability to concentrate urine properly.
Okay.
Then, as it gets worse, you might see blood or pus in the urine, the azotemia, those increased waste products, high phosphate, high potassium, maybe the blood pH is low, acidemia.
But azotemia is basically the kidneys not filtering waste well enough, right?
Exactly. Stuff that should be removed starts building up.
And I assume imaging is super important here.
Oh, absolutely crucial. X-rays, radiographs can sometimes show us stones or maybe an enlarged kidney, bladder, prostate. Or sometimes the detail back in that retroperitoneal space looks fuzzy.
But ultrasound is the main one.
Usually, yes.
Yeah.
Ultrasonography is really the primary tool. It gives us a clear look at that dilation, the swelling of the renal pelvis and the ureters. We can often see if the kidney tissue itself looks thin. And frequently, ultrasound helps us spot the actual cause, stones, a tumor, maybe a stricture.
Is that usually enough, or do you need more advanced imaging sometimes?
Often, ultrasound and x-rays are sufficient, yeah. But in some trickier cases, we might need contrast studies like an excretory urogram or maybe injecting dye directly like nephromyelocentasis, or even a CT scan to really pinpoint the exact spot and cause of the blockage.
Okay. Are there any other, direct ways to look inside?
Yes, sometimes. Procedures like urethrocytoscopy or vaginoscopy can be really useful.
Using a camera.
Exactly. A small camera goes into the lower urinary tract. It lets us see inside the urethra, bladder, vagina directly. We might find the cause of the blockage that way or confirm things like ectopic ureters or that UVJ stenosis.
Okay, so let's say we found the problem, diagnosed it. What does treatment look like? How do you resolve this?
Treatment usually starts with supportive care, often as an inpatient. So IV fluids are key, maybe antibiotics while we're finalizing the diagnosis and just checking the pet's overall stability.
Getting them stable first.
Absolutely. Correcting any fluid and electrolyte imbalances is critical, and if the blockage is lower down, we might need to relieve that initial pressure. Maybe with a urinary catheter, or by draining the bladder repeatedly with a needle serial cystocentesis, or sometimes placing a temporary tube directly into the bladder, a tube cystostomy.
And then the main treatment tackles the actual cause of the blockage, right?
Precisely. The specific treatment really depends entirely on what's causing it and if the pet has any other health problems going on.
Okay.
Now, for ureteral obstructions, specifically blockages in those tubes from the kidney, emergency surgery is often needed.
An emergency, wow.
It really is. But again, it's super important to stabilize those metabolic and electrolyte issues before going into surgery.
Makes sense.
Surgical options can range from traditional open surgery on the ureter, like cutting it open or reimplanting it, to newer, minimally invasive techniques.
Like what?
Well, subcutaneous ureteral bypass devices, they're often called SUs, are a good option, especially common in cats. And placing stents inside the ureter using an endoscope is done more often in dogs.
Are there non-surgical options for, say, stones?
Sometimes, yeah. For ureteral stones, certain medications, alpha-adrenergic blockers, along with IV fluids to kind of flush things through, might help the stone pass. Mannitol, a diuretic, might also be considered.
What about if the kidney itself is just too far gone? Is removal ever the answer?
Kidney removal, nephrectomy, it's rarely the go-to for hydronephrosis itself. It's usually reserved for very specific things, like if there's a tumor just in that one kidney.
Not a routine fix.
Definitely not. And honestly, for the best outcome, especially with these ureteral obstructions, getting referred to a veterinary specialist, someone experienced with these procedures, is really highly recommended.
Yeah, sounds like specialized care is needed. So after treatment, what are the important things to monitor? What's the recovery like?
Well, like we stressed, ureteral obstruction is serious, it's an emergency, needs that specialist care, and follow-up monitoring is absolutely essential afterwards.
What does that involve?
Usually repeat ultrasounds maybe every 2 to 4 weeks at first, just to see how that kidney is recovering. And of course, keeping a close eye on blood work and electrolytes.
Okay.
One thing to watch for after relieving the blockage is something called post-obstructive diuresis.
Meaning they pee a lot.
A lot, yeah. And that can actually lead to its own problems like low potassium levels, dehydration, weight loss. So careful monitoring during that phase is really crucial.
And what if hydronephrosis isn't treated? What are the risks then?
Well, without treatment, that pressure just keeps building. Eventually, it could lead to the urinary system actually rupturing.
Oh, wow.
And, of course, irreversible kidney damage. So if medical management doesn't work to clear the blockage, you absolutely have to intervene, surgically or otherwise, to decompress it.
Right. So thinking long term, what's the outlook? What's the prognosis generally like for these pets?
It really varies quite a bit. It depends on, what caused the obstruction in the first place, how long it was blocked before it got fixed, and whether there's also an infection present. Significant permanent kidney damage can start happening surprisingly quickly within maybe 15 to 45 days of a complete blockage.
That's fast.
It is. Though some damage might be reversible if you relieve it within, say, 2 to 4 weeks. Partial blockages give you a bit more time, generally.
An infection makes it worse.
Definitely. If there's a kidney infection, pyelonephritis, that significantly worsens the prognosis. So
Ow.
treating that with antibiotics is essential if it's suspected.
Okay, so boiling it down, the main takeaway seems to be hydronephrosis is serious. It comes from a urinary blockage. But if you catch it early and treat it properly, often with specialized care, the outcome can actually be positive.
That's a great summary, yes. Early detection, even with those subtle signs, is really key.
And if you suspect anything like this, don't wait.
Absolutely. Get expert veterinary help right away. It's critical.
Right. And on that note, here's maybe a final thought for you, the listener, to chew on. We've talked about all these different causes, right?
A wide range.
So think about your own pet. What seemingly unrelated things in their health history, maybe even past surgeries they've had, could potentially, be a factor down the line for something like this.
It's a good point. Things aren't always obviously connected.
Exactly. It's just a good reminder to be observant, watch your pets closely, and keep up with those regular vet checkups. They really are valuable, proactive steps for their health. Thanks for taking this deep dive with us today.